Hello doctors, this is Dr. Hira Salman. Welcome to MCQ of the day from AMBUS, and today we are going to solve one question. So let's just start. So the vignette says a 53-year-old woman comes to the physician in February because of one-day history of fever, chills, headache and dry cough. She also reports malaise and generalized muscle aches. She works as a teacher at a local high school where there was recently an outbreak of influenza. She has a history of intermittent asthma, for which she takes albuterol as needed. She declined the influenza vaccine offered in the fall because her sister told her that her friend developed a flu-like illness after receiving the vaccine. She is worried about possibly becoming ill and cannot afford to miss work. Her temperature is 37.9, that is 100.3 Fahrenheit. Heart rate is 58, respiration is 12, physical examination is unremarkable. Her hemoglobin concentration is 14.5, leukocyte count is 9,400 and platelet count is 280. In addition to analgesia, which of the following is the most appropriate next step in management? So in the question, if we see, so there is 1 day history of fever, chills. Her age is 53, but she has a history of intermittent asthma. So she is having one risk factor. Now, and she already declined the influenza vaccine. So that is also one of the important things here. And what else? And she also report malaise generalized, that's okay. And this one also, local high school where there were recently outbreak of influenza. So there is outbreak of influenza, she is having symptoms, she is having a risk factor of this intermittent asthma. So these are some important points. And now the question is asking, which of the following is the most appropriate next step in management? What next are you going to do? Are you going to give her supportive therapy only? Are you going to give her imantidine or inactivated influenza vaccine or oseltamivir or live attenuated vaccine? So let's just have a look. Okay, so now you're going to rule out one by one. So first we have the supportive therapy. Supportive therapy, why we are not offering her a supportive therapy? Because in adults with mild symptoms and no risk factors for complications, influenza should be treated with supportive therapy. So if there are any mild symptoms or if there is any no risk factor for complications, in that case you can give only supportive therapy. And supportive therapy includes rehydration, analgesia, antipyretics, antitussives. So you can give a painkiller for temperature control, for cough. Only these are the supportive treatment. But remember, you can give only supportive therapy in cases of mild symptoms or when there is no risk factor. Remember, in this condition, the patient is having symptoms and there is also a risk factor, that is intermittent asthma. However, patients with risk factors or severe symptoms should be treated with antivirals if they present within 48 hours of symptom onset. Since the patient has a history of asthma which predisposes her complications such as pneumonia, additional measures are indicated. So we are worried about the symptoms of having a risk factor and there's a history of asthma in this patient. So we are not going to give her supportive therapy at this point of time. What about imantidine? Imantidine is a drug used in the treatment of Parkinson's disease. Its mechanism of action is not well understood, but it most likely has N-methyl D-aspartate receptor antagonist properties. It was also formerly used in the treatment of influenza A infection. However, as the virus has developed high rates of resistance over the last years, the use of imantidine is no longer recommended. So this one is no longer recommended. We are not going to advise for imantidine. What about inactivated influenza vaccine? The inactivated influenza vaccine is recommended by the Advisory Committee on Immunization Practices for all individuals more than 6 months of age and should be administered annually. However, it is not effective in acute infection. So this vaccine, this inactivated influenza vaccine, is not effective in acute infection, and this question is a case of acute infection. So definitely we are not going to give inactivated influenza vaccine. What about oseltamivir? Oseltamivir is a neuraminidase inhibitor used in the treatment of severe influenza. It has also been shown to reduce complications in patients with risk factors such as asthma, young children, or elderly individuals. You remember the age of the patient is here is 53 years old. So we can give oseltamivir in children, young children, in case those who are having risk factors, like in this case the patient is having asthma, and in elderly individuals, those who are more than 65 years of age. It can shorten the duration of disease if therapy is initiated within the first 24 to 48 hours of symptoms onset. In adults with mild illness and no risk factor, supportive treatment is sufficient and oseltamivir is not indicated. So if you can see the patient is having mild illness and there is no risk factor, no need to give him or her oseltamivir. But if the patient is having risk factor, then and is young or elderly and having these symptoms, so in order to reduce complication, we have to start oseltamivir within 24 to 48 hours. Now, what about live attenuated influenza vaccine? This live attenuated influenza vaccine is recommended by the Advisory Committee on Immunization Practices for all non-pregnant individuals in between 2 to 49 years of ages and should be administered annually. Again, however, it is not effective in acute infection. That inactivated influenza vaccine plus live attenuated influenza vaccine, both of them are not effective in acute infection. The recommendations regarding influenza vaccine change yearly. Updated information from the CDC can be found at their website. So what is the main educational objective? If we can see here, these are the important symptoms in this patient: having chills, headache, outbreak of influenza was there. She declined the influenza vaccine. So given her recent exposure at the high school where she works and her sudden onset of symptoms, the patient presentation is suggestive of early influenza, and her history of asthma puts her at an increased risk of complication. So in this case, in this question, the main objective of the question is, whenever the patient is having symptoms of influenza and you think the patient is having one of the risk factor like asthma, then we should start antivirals, or we should start this neuraminidase inhibitor, that is oseltamivir in that case, in order to prevent the complications in our patient. Otherwise, we can just give supportive therapy like antitussives, analgesics, and antipyretics. So this is all about this. See you in next session. Bye bye.